Hey guys, it's Louis here from ndxvaccine.com, the channel where we try to give you medical diagnostic solutions and bring you medical information so you and your family can stay healthy. Now in today's video, we're going to speak a little bit about high blood pressure and anxiety, but we're going to speak about the number one hidden reason why so many Americans or so many people throughout the world, millions of people throughout the world suffer from this, but it really goes undiagnosed. And the reason I know about this a little bit because it happened to me. Now, this video, it's a continuation of a video that I took out a few months ago. I was able to cure myself when it came to anxiety, high blood pressure, and a fast heart rate. Now, I've never suffered from these things before. And for some apparent reasons, just like that overnight, I developed these symptoms, and I never knew that I had them. So in the video, I'm going to put a link in the description so you can go back to that video, because that's a really good video to watch. I mean, I think I've gotten a lot of views and a lot of comments, and one of the reasons that I'm making this video now is because there's a lot of questions that I need to answer. Now, the reason that I was having high blood pressure and anxiety and a fast heart rate could be a reason why you're having it and it's going unnoticed. So now let me just summarize just a little bit about what I was going through. Then we're going to get into this video, because this video is I think it's going to be good. I'm going to provide you with a lot of answers, a lot of solutions, so you can better your health and give you a key answer to why you might be having high blood pressure, anxiety, and even a fast heart rate, and you do not know, because it was happening to me. Now, in 2017, okay, I started feeling anxiety. I was feeling a little odd. I wasn't feeling normal. Something was going on with my body. And I was stating in the video that I thought that maybe even someone wished bad on me, and I just didn't know why. But anyway, I was able to discover the situation when I went to the dentist. I discovered that I had high blood pressure. I got an examination, and they were telling me that I was suffering from some sort of a panic attack. But anyway, just to keep the long story short, I developed high blood pressure, anxiety, and a fast heart rate. And I went to a lot of different doctors. No one gave me any answers. A lot of doctors were saying, well, you don't have to have a root cause. And the way I understand medicine is this, look, especially now, but even then, I understand medicine. Now, I do nerve examinations for a living, and I examine patients all day. My specialty is the peripheral nervous system, nerves and muscles, and I do nerve studies, and I assist in EMGs, and I do all the other stuff for neurological studies. And to me, the way I understand medicine is that no matter what happens to you, there has to be a reason. So when I develop high blood pressure, anxiety, and a fast heart rate, I mean, there has to be a root cause. There has to be a reason. Now, the doctors were not telling me any answers. Just the basic questions: does your father suffer from anxiety? Does your mother suffer from anxiety, of high blood pressure? I'm like, what they're going through has nothing to do with me. I mean, if they suffer from high blood pressure, which my mother doesn't, my father does have anxiety. I mean, there's reasons why he has anxiety, and maybe he never took the notion to find out why he suffers from these things. And he takes his medication, he's fine. But if I'm suffering from it, to me, I have to have a reason why this is happening. And that's what I was trying to explain to the doctor. The doctor was telling me, no, you don't have to have a reason. I was like 47 years old at the time, and he's telling me basically you're an older person now, and sometimes you could be prone, you can have a genetic disposition. Anyway, whatever answers he was giving me, I was just not buying it. To me, 99.9% of what happens to you, especially when you don't have it, there has to be a reason why. That's just the way I understand medicine, and I was not going to stop until I did. But anyway, I also stated in the video that I ended up in the hospital. Okay, I woke up in some panic mode, like someone just slapped me in the face. I woke up, took my pressure high, my heart rate high. I was anxious, and I just thought that I was just going to catch some sort of stroke. And went to the hospital. In the hospital, I'm thinking I go there with my wife. My cousin later on arrives, and to me, it's like, you know what? I'm going to find out what's going on. Why am I feeling anxious? Like, what's going on with me? Doctors came, they did all kinds of blood tests, they did all kinds of tests. Everything was negative. And again, no answer. I was like, why am I feeling this way? They were saying, you know what, this is mental. You need to see a psychiatrist, a psychologist. I'm like, listen, this is not something about my brain or my mind affecting the body, or this is about my body affecting my mind. I know myself. I've been in my body for 47 plus years. And now I feel odd. I feel like something's going on. Liz, if I didn't have high blood pressure, okay. If I didn't have a fast heart rate, okay. But I had all three. I'm like, something's going on. And I just want to know why. No answers. Anyway, now we're going to go into what this video is going to be about. Let me tell you guys something. The most important thing in life is not diet and exercise. The most important thing in life is two components. And if you learn these two components, you're going to be a healthy individual, because a lot of things develop on these two components. I mean, more stuff, but these two components are key. The most important thing in life, I repeat, is sleep and breathing. You can eat all the diets you want. You can eat as healthy as you want. You can exercise all you want. But if you can't sleep properly, and if you can't breathe properly, you have nothing. Now, what happened? Why did I develop these things? Now, this is what this video is going to be about. Why? Because I was a mouth breather. You see, your body, right, needs oxygen. But you need the right type of oxygen. You need the oxygen that comes from your nose. See, when we breathe through our nose, the oxygen gets filtered, and our entire bodies and brain and cells and your cardiovascular system, which is composed of arteries and veins, and your peripheral nervous system, which is composed of nerves and muscles, your autonomic nervous system, your organs, just everything gets furnished with oxygen. I mean, think about it for a second. Sometimes I discuss it with my patient. Let's just say we're in a room, and they slowly start to cut off the oxygen. What do you think is going to happen? Well, eventually we're going to pass out, and eventually we can die. Why? Because our bodies are not getting the right type of oxygen. So what do you think is going to happen to your body, to your organs, to your brains, to your arteries, to your nerves and muscles, if you're not getting the right type of oxygen? You're going to get sick. So if you breathe through your mouth, if you become a mouth breather, or if you're a mouth breather and you do not know, you're going to get sick. But one of the chief reasons that you could be having high blood pressure, anxiety, and a fast heart rate is because you're breathing through your mouth. Now guess what? When you breathe through your mouth, you can develop sleep apnea. And that's what I had. I developed sleep apnea. So what was going on? How I was sleeping all my life. Well, all my life I've been breathing through my mouth, without a doubt. I mean, breathe through my nose too, but I was a mouth breather. And when I went to sleep, I would snore and I would breathe through my mouth. I remember, because I would always sleep on my back for the most part, like 70%, 80% of the time. I'll sleep on the sides and I'll sleep on my stomach. But most of the time I would sleep on my back, and I would sleep with my mouth open. I remember. And a lot of times that I would wake up in panic mode, I woke up in panic mode and I ended up going into the hospital with a fast heart rate, and I was anxious, and my high blood pressure. I woke up in panic mode, which I speak about in that previous video. I was sleeping on my back with my mouth open. So if you sleep on your back, right, and you have a flat pillow like I did, and you're going to have the tendency of opening your mouth, and you're going to breathe through your mouth, especially if you're a mouth breather during the day. So if you're a mouth breather during the day, you're going to be a mouth breather during the night. So we're going to speak about some techniques. I'm going to give you guys a lot of different solutions. I'm going to just basically turn every stone when it comes to helping you guys to breathe through your nose and not through your mouth. I mean, there's some circumstances where there's some people, and I know I had a couple of subscribers, they cannot breathe through their nose because they have maybe a deviated septum, they have some issues there, they need to have surgery. That's perfectly fine. Maybe those patients, they do have a CPAP machine, but if you don't want a CPAP machine, then you need to listen, because I don't have a CPAP machine right now. I sleep perfectly fine. I don't have any anxiety. I don't have any high blood pressure. I don't have a fast heart rate. I was able to cure myself like I did in that video, but I was able to find out why. Now, a lot of doctors these days, when you go into the offices and you have high blood pressure and all these symptoms that I mentioned, they're going to just give you medication, and they're not going to try to get the root cause. They're not going to try to get to the root, to the cause, or to the root cause of why you're having these symptoms. I don't know why, but that's how they practice medicine. But I don't understand that medicine. I don't understand medicine that way. But let me tell you something that I had kind of written down here. Let's see. The doctor of the future will not cure or treat the human body with drugs. I mean, you're always going to have some drugs, but when you treat the human body with drugs and that's all you do, that's a problem. It says, but rather it will cure and prevent disease with nutrition. That sounds logical. In fact, when we get sick, my son just got sick the other day. I mean, mild, caught a little fever. He went back to school, and they do have masks on, but you know how these kids are. They start touching things, and my son is 6 years old, and he's a boy. Somehow he got a little sick. But what happened? We took him, and he tested negative for COVID. He was fine. In fact, when he went, he had no fever, but he wasn't 100%. But obviously, my wife will give him chicken soup. We'll make him chicken soup. We'll give him some types of foods that will help him recuperate. So nutrition is very, very important when it comes to our health. And that's why in the future, or even so now, it's really important that these doctors understand that no matter what happens to us, there has to be a reason. Not everything has to be here. Drugs, you don't have to have a reason. You can have a pre-genetic disposition. And that's why they told me. But I'm in the medical field too, and you just can't speak to me that way without me disagreeing. I mean, there are genetic dispositions. I met kids 5, 10 years old that have diabetes. That's a genetic disposition. But if you never had diabetes, and you're all of a sudden you're 45 years old and you have diabetes, it's not a pre-genetic disposition. You did it to yourself. 90% of the times when we end up with high blood pressure, diabetes, anxiety, we're doing it to ourselves. In my situation, I'm not an exception. I was doing it to myself. So I developed sleep apnea. Okay, and one of the reasons that I developed sleep apnea, okay, it's really important that you understand this, because we're going to speak about a lot of different things, and I'm going to try to summarize this quickly because we're going to take out a lot of videos on that. Now, one of the things that you need to understand that your bite, and when you have sleep apnea, most people that have sleep apnea, they're either chronically overweight, and they have a lot of tissue in their throat, and their airways get compromised where you don't have enough air going in. You're going to wake up in the middle of the night. So one of the symptoms is you wake up in the middle of the night, you're gasping for air, you're choking, you could develop insomnia, you develop a lot of different things, but you can't sleep. My throat is getting a little dry here. So, but when you're not overweight, another thing that happens, like it happened to me, if you have an overbite, okay, it's really important that we have a good bite. Now, I still have an overbite. I do some tricks here so I can kind of expand my mouth a little bit, some exercises, but I have an overbite. So when you have an overbite, the top of your mouth goes forward. So you have like more teeth going forward. And then this is back. Okay, so you don't have much of a chin. When you have a perfect bite, you have a nice jawline, your teeth are going up, and your cheekbones are nice and high. But when you have an overbite, then your cheekbones, it kind of just drags your face. That's why it's really important that we don't breathe through our mouths, because when we breathe through our mouth, we're dragging our faces down. So we have to breathe always through our nose and not through our mouth. And when we get older, we start developing these habits of breathing through our mouth, and it's not healthy. Something that I was doing all my life. Okay, so when you have an overbite, you kind of restrict your airways a little bit, and your airways are a little bit more narrow, so you don't have a lot of air going through. Now, to top it off, you can develop sleep apnea because now if you start sleeping on your back and you start breathing through your mouth because of your bite, people that have an overbite have the tendency of opening their mouth, like I did. And how did I develop the overbite? Because I was a mouth breather all my life. So if you breathe through your mouth, you're going to develop an overbite. You're going to develop crooked teeth. There's so much, but we're not going to get into the implications of an overbite because then we're going to go over this video. We're already at 16 minutes, and I want to summarize this thing like at 22 minutes. So we're going to speak about breathing. So when you have an overbite, you got to be able. What I do now is I sleep. I don't sleep on my back anymore. I don't sleep with a flat pillow. I sleep with two pillows. I sleep on the side, a little bit more elevated. And I pay attention to not open my mouth. Now, what I do during the day now, let's go back to sleep. So if you sleep on your back with a flat pillow, you're gonna have the tendency of opening your mouth, overbite or not, but more if you have an overbite. Now, if you elevate yourself a little bit, if you put two pillows, or maybe even three, and you sleep on the side, either on the right side, left side, you close your mouth, you're gonna have, if you sleep that way, you're gonna have a tendency of keeping your mouth closed because you're sleeping in a different position. So it's gonna be a little bit more unlikely that you're going to open your mouth. You still could open your mouth. You could still breathe through your mouth, but not as much if you was to sleep on your back. And I was sleeping on my back all the time. So people that sleep on their back with a flat pillow, you're gonna open your mouth. So no matter what, you can't breathe through your mouth. So we're gonna have to change that because you can get sick. Okay, that type of oxygen is not good for your body. That can get you sick. You need the right type of oxygen. The right type of oxygen is when you breathe through your nose. Now, one of the things that you can do during the day, right, is to be conscious about it. Always breathe through your nose. Number one, because if you're conscious about it, if you train yourself during the day to breathe through your nose, then at night, all that information is going to be in your subconscious, so you're going to always remember to breathe through your nose. Now, a lot of times I wake up, maybe in the middle of the night, just wake up a little, and in those seconds that I wake up, I'm in a good position, my mouth is closed, and I know that I'm not breathing through my mouth. Now, another thing is tongue posture. A lot of people do not know this. I learned this a couple of years ago. Now, if this is the roof of your mouth, right? And this is your tongue can't be just dangling. You need to have good posture on your tongue. And your tongue has to be flat against the roof of your mouth. So that means that during the day, one of the things that you need to practice if you're a mouth breather is you close your mouth and your tongue has to be to the roof of your mouth. If you practice that means when you sleep at night, and I've been developing or practicing good tongue posture the whole time, and wake up in the middle of the night sometimes I wake up and my tongue is in a good position. Now what that does too, when you have good tongue posture, you can look it up. It elevates your face. See, if you breathe through your mouth and your tongue is dangling, it's going to drag your face down and you're going to develop more of an overbite and you develop crooked teeth and when you're older, you can develop all kinds of problems when it comes to your teeth. Now, if you're young, or even if you're older, if you have good tongue posture, what that's going to do is going to elevate your cheekbones and it fixes your bite a little bit because then your upper teeth will go up. And then everything kind of correlates a little bit. So you have to have good tongue posture no matter what. Now, another thing that I do, right, when it comes now, you can tell one of my subscribers asked me, okay, listen, what can I do? How can I control my breathing? Well, I just mentioned the techniques of sleeping properly, elevated pillows, sleep on the side, you can sleep on the back. During the day, you breathe through your nose, not through your mouth. Develop good tongue posture, and that is going to help. Now, another thing you could do, you can have an orthodontic consultation. You can go see your dentist, and maybe he can tell you if you have an overbite or not. Sometimes it's just simple. Sometimes you're just developing bad habits. Maybe you don't have an overbite. You're just developing bad habits now as you're getting older. But if you get older and you breathe in through your mouth, then it's just it's gonna affect your face. It's gonna accelerate the aging process. And if you're 40, 50 years old like me, you don't want to get old too fast. You want to slow down the aging process. You don't want to accelerate it. So if you want to accelerate it, you want to look your worst, then continue breathing through your mouth. You're gonna see what you're gonna look like in a couple of years. You're gonna develop, your face is just gonna drop, and then you're gonna develop all kinds of health problems. You gotta breathe through your nose. That's final. If you can't breathe through your nose, that's a whole different story. But if you could breathe through your nose and you're breathing through your mouth because you just don't know, then you need to stop breathing through your mouth. Okay. So another thing you could do, you can seek an orthodontic consultation. Maybe get some Invisalign, maybe get some braces. If you have an overbite, improve your bite. Maybe you have strong bones and you could do that. Or you can get some sort of retainer that will help you keep your mouth closed. That's another thing that you can do. Then, I don't know, maybe you will have to, maybe you can talk to an ENT doctor. If you think you have sleep apnea, then you can have a sleep study. You want to know if you have sleep apnea or not. If it's mild, I mean, I haven't had a sleep study. I'm supposed to go for one, but I have everything under control. Since I understand the situation, it's part of, I don't practice sleep study, but it's within my field as well. As I'm in the field of electrodiagnostic medicine, but I do nerve examinations instead. I don't do sleep studies, so I understand how that works. I'm able to kind of clinically correct the situation. But like I said, the orthodontist, you can get a mouthpiece that will help you keep your mouth closed. And then when you also, if you do have a sleep study, the ENT doctor, he's able to check your throat and see if you have excessive tissue back there. And he's able to check your nose to see if you have a deviated septum. You want to rule all these things out. And if you want to also know if you're a candidate for surgery, sometimes you're going to have tissue and you can't breathe through your nose, or your airways are compromised because you have tissues. I mean, I didn't have any of that. The doctor was like, I don't even know why you're having problems sleeping, but I was, in my situation is the overbite. So now one last thing that you can do almost automatically, and you can look it up yourself. I'm not even making this up. So one thing that I do to keep my mouth closed, because I don't have a mouthpiece, I don't have a guard. I will get a guard. I am going to seek an orthodontic consultation soon. I put tape in my mouth. So what I do, okay, take a little bit of tape. Now there's different types of tape. There's a tape, which I don't have that one. I'm going to get it. And this is one of my subscribers that asked me, how can you keep your mouth closed? There's a tape, right, that you can put in your mouth, but it has an opening. So if you open your mouth, you can breathe, and nothing's going to happen. But when you don't have that opening, you can't put the tape like this, because then if you try to breathe through your mouth while you're sleeping, you're going to wake up, and it's not good. I was doing that before, but then what I do is I do this. I put it like this, and I go to sleep. Now, I could still speak. If I open my mouth just slightly, I could still breathe, right? Nothing's going to happen, but it helps me keep my mouth closed, and it also helps me from snoring. So there you go. That's if you have good precision when you sleep. If you do a little bit more research, we're going to take out a lot of more videos when it comes to breathing, when it comes to tongue posture, when it comes to high blood pressure and anxiety. But one of the number one reasons that people get high blood pressure, anxiety, and a fast heart rate is because of sleep apnea, because they breathe in through their mouth. You just can't do that. But anyway, if you find this video helpful, please refer this video to your friends. We're going to take out more videos when it comes to diagnostic healthcare. There's so much information. So anyway, subscribe to the channel. We're going to take out much more videos. Turn on your notifications, and that way when I take out my next video, you'll be the first to know. Okay? I'll see you in the next video. Bye-bye.